Hello dear friends, this is a case of a 84-year-old male patient who presented with significant abdominal pain, tenderness, dilatation, and has not opened the bowels for 4 days and vomiting. CT scan was done. Let's scroll the images up and down. It is obvious that there is significant bowels dilatation. This is always a challenge for the radiologist to find the transitional point where exactly the bowel is obstructed. First of all, we have to see if there is small or large bowel obstruction. As we can see here, here is the anorectal region. There are some feces here. There is some diverticulosis, but anyway, the large bowel is not dilated. Here is the descending colon. If we follow it and track it, we will see the whole large bowel here, 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 the transverse colon, it's not dilated, so the large bowel is not dilated. Here is the appendix, which is normal, here. Okay, so what we have is dilated small bowel, but let's check the distal, the terminal ileum. As we can see, we can see that some terminal ileal loops are not dilated, so the obstruction is not here. It's proximally to that point, and we must find it. One leading point is the following: if there is long-standing small bowel obstruction, a common point in this case is fecalization of the small bowel. So near a fecalization, a fecalized small bowel, we can find the obstruction. Here is a dilated small bowel loop with some fecalization, and exactly here is the transitional point. Let's follow the dilated bowel loops from that point. Here is obviously dilated. Let's follow it. Here it goes this way. Here, here, here. Here is the fecalization, and there is an abrupt stop right here. So this is the transitional point. Beyond this point, the small bowel is again collapsed and goes up to the terminal ileum. You see, it's collapsed and goes up to the ileocecal valve finally. So here we have a case of possible adhesions. This is the cause of the small bowel obstruction. So just remember that if you see a significantly dilated loop with fecalization, like in this case, just near this point is the obstructing stop, the transitional point. Okay, let's see it in coronal views. Just pay attention here. Here is the dilated small bowel, and this is the transitional point, and after that point we can see the collapsed small bowel. Sagittal view. This is the dilated small bowel with fecalization. We can follow it, and here exactly we can find a stop, and here is the transitional point. This is a collapsed small bowel. Beyond that point, the small bowel is collapsed. Once again, here is the transitional point. Here is the collapsed small bowel. I go back again. Okay, this is the transition between the dilated small bowel and the collapsed. So this is very useful information for the surgeons. Another interesting point is that this patient underwent some surgery in the past, and we can see some midline scar here. So this can explain the adhesions or development for some reason. So that's it. Thank you very much for your support. And here is a right-sided stoma. Okay, sometimes the history is not complete by the clinicians, but anyway, the finding was found. Thank you very much. Please subscribe to my channel if you find my videos interesting, and see you the next time with another interesting case. Bye bye.